normal.
You know, a sunburn, a heat rash can really put a damper in your, summertime fun. I'm here with Dr. Jeremy Crisp with Lexington Family Practice to talk about the importance of skin health. So thank you for giving me a couple minutes of your time.
Thank you.
Quickly go over how important skin health is.
Sure. Yeah. Well, we all know the old saying, the skin is the largest organ of the body, so it certainly is important. And it's also important because we see it. Other people see it. We want our skin to look good, but we also want our skin to feel good. And so skin health is really important not only for those reasons, but because it can also be a reflection of things going on internally inside of our body and other problems that may be going on. So it's important to pay attention to the skin.
So what are some of the things you see commonly here in your practice?
And it's really common to see rashes that are associated with the heat, whether that's heat rash. We see poison ivy and poison oak this time of the year a lot as people are doing outdoor activities. People that have other skin conditions such as eczema or psoriasis can sometimes see flare-ups during the summertime. But here in family medicine, we see all variety of skin problems, whether it's from the day-to-day wear and tear on our skin, from rashes or injuries, all the way up to other things that may come up with other diseases, whether it's skin cancer or other problems from other things.
Are there some people that might be more susceptible than others?
Everyone, no matter what skin type you have, is susceptible to sun damage on their skin. And so that's probably the one thing that we talk to patients about, is really protecting your skin in the summer, particularly if you're on medications that make you more sun sensitive. But everyone should be wearing sunscreen or hats or long sleeves to protect themselves from the sun. Obviously, people that are of more fair skin and fair skin tones are more susceptible to sun damage, sunburn, and even more susceptible to skin cancers later in life.
What's the difference between healthy and non-healthy skin, maybe when we kind of put burns aside?
Skin is one of those things that you kind of have to take care of it every single day. You don't want it to be overly dry. You don't want to use harsh chemicals on it. So I think people that take the time to take care of their skin, use good moisturizers, good sunscreens on it, to not only prevent burns, but to prevent those signs of aging, but also to prevent skin cancers is very important.
You made a very good point about it's also a reflection of what's going on internally. Is there something that maybe is not obvious that people should maybe think about?
Anytime you have a new skin rash or a change in your skin, that does not go away after a couple of days, certainly if it's associated with pain, then I think it's important to see a physician.
Great. Well, thank you, Dr. Crisp. I really appreciate your time, right? So wear some sunscreen and don't ignore those symptoms that Dr. Crisp just mentioned. Thanks so much, and back to you in the studio.
All right, Rosemarie, thank you so much. Stay with us. There's more Friends at 5 coming up after this short break.